Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Machina edition. This audio podcast as part of a Quantix broadcast. This audio podcast as part of a libostics biome. This audio podcast as part of a Storm Libostics production. In this audio podcast. In this Storm audio podcast, a look at works of a look at works from a research poster presentation from 2013 and the importance of renal diagnostic screening context of community pharmacy, and where this research poster presentation looks at this looks at a sort of renal diagnostic screening and renal diagnostic screening as a subject as a subject review. The research poster presentation from 2014 looks at a collaboration between two academic institutions in the United Kingdom, and one community based pharmacy in the sort of in the sort of south of the UK, in the south region of the United Kingdom. So the aims of this works was to highlight the importance of renal screening in community, in this sort of community pharmacy setting, and prospectively looking at how pharmacists could initiate a sort of novel screening programs to prevent CKD or chronic kidney disease. The hypothesis, and where this research poster presentation was sort of before going on, was a research poster presentation that formed part of the research posters at a research in practice research sort of a practice research in practice annual symposium in the south in the south region of the United Kingdom, in the south region in the United Kingdom in around 2013. The hypothesis in around this works was, since the implementation of what had been referred to, or what had been evidenced in context of and aligned to sort of pharmacy practices, the since the implementation of the new pharmacy contract, or the MPC, which was initiated or instigated in around 2005 by primary care trusts, and the pharmacy and sorry and the pharmaceutical services negotiating committee, the PSNC, and the community pharmacy, community pharmacy is now able to provide or offer enhanced services. So a little bit into the sort of the different forms of services in context of primary care. There are sort of essential services, there are advanced services, and there are enhanced services. And pharmacists, by background, according to the NPC, are able to, or had been able to put together sort of a case for particular services in particular communities or amongst communities where there may be a need or requirement, and thus according to the enhanced services, this would allow pharmacists, for example, to implement implement a sort of enhanced services, but also be applicably sort of applicably sort of applicably sort of contracted so thus to be imbursed to ensure that that amongst particular prevalences or condition prevalences are and are sort of are sort of made are sort of made sustainable in amongst communities and amongst primary care. Sorry, in amongst primary care or amongst in amongst sort of prevalences in amongst primary care, and so um, uh, as part of the hypothesis, the uh, the uh, the again the community pharmacists are and can provide or offer enhanced services, and it would be advantageous to explore or investigate a feasible sort of renal screening program in amongst the community pharmacy setting. So the background to this was where CKD is a long-standing condition that had been described as the gradual, unusual, permanent loss of kidney function over time. Early in the disease process, people recipients with CKD are often experience no symptomologies or no symptoms, and CKD has for a long time been under has been for a long time an under sort of diagnosed condition. Even with the absence of symptoms or symptomology, CKD appears to add significantly to the burden in regard to more in regard to morbidity morbidities to the burden of morbidity. And first and possibly most important, the incidence of condition has been changing. In addition, the age of patients entering into CKD has increased progressively, and patients or recipients with specific primary care conditions, for example, survive. However, where CKD has where CKD causes its own sort of implications. Currently, and sort of yeah, currently, or at least at the time of this research poster presentation from 2013, diagnostic investigations, pharmacotherapy, and ongoing treatments for renal failure or CKD are provided and offered by NHS, National Health Service or NHS trust hemodialysis treatment at the hemodialysis treatment within the NHS at least in around 2000 in the early two in around in around the in around the 90s or the noughties and up to the sort of a new millennium around the new millennium and sort of around the new millennium, the hemodialysis treatment costs the NHS National Health Services around 20,000 to 25,000 per patient per recipient per year, according to the National Service Framework for Renal Services from 2005. Unfortunately, the most suspect patients are referred to nephrologists to specialists only at a time when renal function is close to the level of where dialysis is required, and that is not much. That is when, unfortunately, not much can be expected from conservative renal protective treatments. According to renal protective treatments. So the research poster presentation now sorts to highlight some basic concepts in screening or in around investigations. So pharmacists who work either in hospital or in primary care, and those with access to electronic patient records, also need to be familiar with test results or investigations and what they mean. Screening or test results can be expressed qualitatively, quantitatively, or semi-quantitatively. Hematology and biochemistry but hematology and biochemistry results are generally expressed quantitatively through for example, a set of numbers in reports, and these can help healthcare professionals sort of interpret specific clinical and biochemical parameters, and correct interpretation can help in care plans, in amongst care plans. Not all laboratory data are of particular relevance, but a general knowledge of these is recommended to understand medical background. So now some works or some literature in regard to the importance of renal diagnostic screening and prevention and monitoring disease or prevention and monitoring sort of disease. So the number of patients taken into renal replacement therapy or RRT programs has gradually increased over the decades. The National Service Framework for Renal Services has two parts. Part one, which was published in around 2004, outlines dialysis and transplantation, and part two was published in 2005, refers to chronic kidney disease, acute renal failure, and end-of-life care. The Department of Health at the time had written these guidelines as criteria of how services for renal patients should be carried throughout the United Kingdom. Specific programs should promote the early detection of CKD and comorbid conditions, and use of appropriate outcome measures to clarify patient care, implementation of strategies to delay disease progression and or prevent implementation of strategies to delay disease progression and or prevent uh, or sort of treat complications. The consequences of late referrals include increased mobility and uh, resource utilization. The poster presentation highlights or informs of the five forms of CKD, chronic kidney disease stages, and they're next to each CKD stage there is a linked sort of a linked sort of severity in context in context of sort of glomerular filtration rate. Um, Near patient testing, near patient testing in community pharmacy now. So near patient testing, near patient testing and when near patient testing as another form of another terminology which is more applicable in laboratory medicine. In context of laboratory medicine is where sort of retrospectively literature refers to near patient testing as point of care testing or POCT and near patient testing or POCT and sort of screening in pharmacy can be used to fulfill three main objectives. Number one, to assess the risk of disease. Number two, to screen the presence of disease, and three, to manage the disease. Near patient testing or POCT screening offers an opportunity for a community pharmacist to enhance sort of blood services to enhance sort of blood services, blood and urine investigations can be utilized to investigate renal function. And in terms of blood samples, the substances of intrigue would be serum creatinine, and blood urea nitrogen or BUN. Now looking at linking aspects of POCT or NPT with what is referred to as medicine use reviews, which is linked to an advanced part of an advanced, not so much as an enhanced service, or the implementation of an enhanced service in amongst primary care pharmacy, but as an advanced service in amongst pharmacy, primary care pharmacy. So medicine use reviews allow community pharmacists to provide emphasis on drug formulations to help reduce nephrotoxicity in high risk patients, and in high risk patients back to general practitioners or primary care physicians, enhancing communication and allowing collaborations in primary care. Medicine use reviews, or what's referred to as MURs, are also important because they can allow experts to better monitor drug interactions, contraindications, and uh, sorry, and what and also document where sort of where and sort of document sort of the and document sort of the drug interactions and contraindications, and the acceptable daily intake and safety limits of particular excipients excipients for some suspect for some suspect renal impaired recipients or patients um, must be checked. Hence, why medicine use reviews, medicine use reviews or MURs for some time have been have been implemented in amongst primary care in amongst sort of primary care pharmacy. So now a little bit in regard to the the in regard to sort of the specifics, some specifics in regard to the NPC from retrospect from a retrospective basis, and then I look at aspects of the role of community pharmacists in context of a link between MURs and also aligned to the NPC, but also a link to prevention and monitoring prevention and monitoring. So now that the NPC has allowed has prompted advanced and enhanced services, community pharmacists can play enhanced roles to allow better self-care approaches and interventions for suspect or high risk patients in amongst primary care. Providers and policymakers and payers should view CKD as a public health problem, and also initiate screening programs to address this to address the to address to address the incidences and the incidences and the prevalences. And so where MURs are concerned, medicine use reviews are concerned, and where POCT is concerned, in amongst the profession, there has not been unfortunately any sort of practices that have implemented POCT that link with MURs or MPTs or near patient testing, point of care testing linked with MURs or medicine use reviews, with medicine use reviews to prevent and monitor aspects of acute kidney injury, AKI, or sort of the symptomologies aligned to CKD or chronic kidney disease. Some conclusions. An effective system would require a sort of computerized databases that code for age, ethnicity, and for example arterial blood pressure or ABP, and renal function, as well as diagnoses, screening programs in amongst community pharmacy and and in context of the hypothesis in this research poster presentations require investigation, requires sort of investigation, and it would be viable to detect renal insufficiency in amongst the community pharmacy backdrop. That draws this audio podcast to a close. Again, there will be with this audio podcast on social media, there will be some references or literature that listeners can refer to identify what works in regard to the general sort of basis of this research poster presentation, or the general theme of this poster presentation. Draws this audio podcast to a close. This audio podcast has been part of a Machina edition. This audio podcast as part of a Quantix broadcast. This audio podcast as part of a Lobostic biome. This audio podcast as part of a Storm Lobostics production.